is a reason why we still face these roadblocks, but also this perception of red bad, blue good is not true. Non-corporate blue, good. Corporate blue, not good. And so understanding that that is the order of the day is something that we still need to get through. But we also have another big problem that is probably something that you all deal with regularly. And I would like all three of you to comment. And that, of course, is how do you pay for it? Now, of course, if we had a universal healthcare system through Medicare for all at the federal level, that's a different story. But at the state level, you have to work it within the budget. Friend of the show, Tom Hartman, has explained that there is sort of this poison pill, if you will, that if you pass it at the state level, there is a limit in terms of what type of federal assistance you can actually get. Now, if we can get past that, again, forgive me for not knowing the specifics of it. Maybe one of you might know what I'm referring to. What is the best explanation that you can give? Like if you're giving that elevator pitch to somebody who says, oh, it sounds like a great idea. I would rather spend, $150 a month on healthcare than $550 a month. But how is that possible? If you can explain that, whoever wants to jump in, go for it.
I have to do that a lot, and so I'm happy to try to continue the argument, because that is clearly one of the most difficult components to challenge when the opposition uses fear tactics and sound bites. It's very easy to attack it with sound bites, and there's a lot of nuance in the response. The reality is that, yes, it is every legitimate study and analysis, including even just now, the governor's Healthcare Affordability Commission just ended and makes it very clear that our system is unsustainable. Now, that being said, just saying that, well, single payer is less expensive doesn't mean you can just snap your fingers and make it happen, because you're talking about getting rid of copays, deductibles, and what have you, and moving to a new system that does require taxation, which is also a dirty word that's very easy to attack. But the reality is that 70% of our healthcare expenses are essentially government paid for anyway, through state and federal funds. And so we're not talking about a huge delta that we need to bridge. And so when I met with the Department of Health and Human Services, they did say that the waiver programs can cover a wide range of federal programs that come into California, for example, and that if we show cost savings, those extra savings will continue to come to California. Now, what I do hear at times is, well, how do you know if a Republican gets elected and they don't want to fund it anymore? Well, the reality is that Trump did try that with a lot of our ACA waiver programs. It was unsuccessful, because the reality, and we saw that with the Republicans. But how often did the Republicans campaign on getting rid of the Obamacare, getting rid of the Affordable Care Act? When push comes to shove, it was difficult for them to do it, because in those town halls, people didn't want to give up what they had. Once we give people and show them that what they can get, it's very difficult to take it back. But at the end of the day, it does take a leap of faith. We can't hamstring ourselves on what our potential is based upon what the bad guys are going to do someday in the future. If we allow that to happen, we're always going to allow the Trumpers and the right-wing conservatives and the corporate Democrats to dictate what we're allowing ourselves to achieve. And it does take a leap of faith to do that, though, and to say, you know what, we can do this. But we can make this happen, and we can have a waiver program that gets accepted. We can pass a taxation system that is progressive, and we can make sure that families and businesses are paying far less than what they're paying now. And, oh, by the way, make sure the Walmarts and McDonald's of the world are paying their fair share too. That all is possible, but it's only possible if we open up our hearts and our imaginations to it, because the data is on our side. The facts are on our side. But there's no doubt that it will be a difficult argument to win when we're being when the opposition is going to be just infiltrating us with negativity and false facts and fear. And that's what we have to look ourselves in the mirror and say, as activists, as legislators, as academics, as policy wonks, are we willing to win that battle? Because it's not going to be an easy one.
Yeah, I actually like what Cheryl said, in that it can't be worse. And I actually think that that's really important, because right now it's really bad. It's really bad for most people. I mean, the percentages of people that are uninsured, underinsured, it's out of control. GoFundMe is not supposed to be a healthcare program. And so the fact that we're living in it, it's very dystopian. It's really weird. And so when people are worried about losing that, I'm thinking, God, we've really hit the bottom of the barrel. Like you're worried about losing what I think is the worst healthcare in any developed country, and you're worried about that. So what is the best way to sort of portray that? Because it's bad.
Well, and it goes back to this false sense of American exceptionalism that, well, yeah, we have to pay this, that, but we are so much better off than everyone else. And that was part, I know that in Wendell's prior career, that was part of what his job was, to instill in us the sense that, well, yeah, we have issues, but it's way worse in Canada. It's way worse in the UK. Oh, the lines they have to wait in and this, that, and the other. And it's just completely false.
Yeah. Their arguments are not even that good. You see, this is the thing. And this is why Wendell and I get along so well. We've actually communicated in private. And it's like, unfortunately, our country, individually, we're actually very savvy. But as groups, we're very dumb. And so you see this a lot with this whole like group think of, oh my God, what am I going to lose? I'm not going to get this, that, and the other thing. But I tell the story a lot. I lived in a very nice townhome community in Delray Beach for a number of years. And one of my neighbors happened to be somebody who worked in the for-profit medical supplies business. And he was making an unbelievable amount of money. So much so that he owned a beautiful home on a lake and he drove a C63 Mercedes.
This impresses you. It does nothing.
That's not what I'm saying. Okay. It's not impressing me. I'm saying that people work in this industry. They know what they're doing is bad. They're not stupid. They know what they're doing is bad, but they do it anyway because the money is just so damn good. And I'm thinking that that's one of the biggest pushbacks that all of you have seen. And, Wendell, you could certainly speak to this. Cheryl, I'm sure it's a big problem in New York as well. There are people who profit immensely from this crooked system, and they don't want to give it up. If you are doing a job, even if it's screwing people over left and right, that's making you $300,000 a year, you're not just going to give that up without a fight. And if that means that you personally are going to donate to your representative $10,000 every election cycle to make sure that nothing happens to that business of yours, then, hey, the investment's worth it. If you have to give up 5% of your income in order to make sure that you're making a killing in an industry that shouldn't exist, yeah, I would say that that's a pretty good investment. And I would say that probably as much as anything, is one of the biggest obstacles amongst the constituency that we face that people are not talking about as much as I think they should be.
Yeah. Wendell, how do they sleep at night? I'm seriously, at this point, there's no excuse. Like, everyone knows this. The numbers are clear. The most conservative studies have shown that we save money from switching to a single payer. So how do people sleep at night when they really know that they are basically just, stealing all the money?
They compartmentalize. They can see themselves as good people, and they're doing a job. They make money to pay for the kids' education, to pay the mortgage, and they may go to church. They may be involved in their communities. They do things to make them feel like they're good people. And they compartmentalize this part of their lives. The other thing, though, I want to stress is that most people who work for these big companies, even if they make a lot of money, they don't have a lot of visibility necessarily into how decisions are made at the very top. I was unique in having that visibility. So a lot of people, believe it or not, within these big companies are kind of clueless. And you can also lead a pretty good life of being far removed from how people have to experience our healthcare system. They don't necessarily come into contact with people who have to go to GoFundMe to raise money to pay to cover their deductibles before they can get the procedure they have, or to keep from going into bankruptcy. It's complicated, but Peter's right too. A lot of it is just you make a lot of money, and sometimes you can drink a lot and feel better about yourself as you go to sleep at night.
Oh. Okay. Maybe that's how Elon Musk does it.
Or it could be like Hillary Clinton says, which is, it will never come to pass. So go make that money while you can, baby. Yeah. But I think that there's too much momentum now. And I think that probably more than anything else is really what it's about. I want to believe this, Wendell, because you've been on this earth longer than I have. I'm sure you've seen there have been times where, yeah, you thought, all right, now maybe there's some momentum there. Maybe we're starting to catch something. Is it fair to say that this is the closest we've probably been since, frankly, probably since the days of JFK? I mean, he was really the last president who openly, as the commander-in-chief, openly said, I mean, if anybody has not seen the video of him speaking at Madison Square Garden in 1962, he basically outlines universal health care to a T and why it was necessary. And I've never seen a president do that since. I would like to think, and obviously Bernie would have been doing that if he was president, but would you say that we are much closer, or maybe as close now as we've ever been? Is that fair?
Without a doubt. There's no doubt that's correct. I think we may think that, we haven't been hearing very much about Medicare for all in recent months. And a lot of people around the country are not aware of what's going on in California and New York and Washington and Oregon and a few other places. But I do think you're right. I think we are getting close. We're closer than we ever have been. People are beginning to realize that this system, even with insurance, more and more of us are functionally insured. I was asked to form a coalition, which I lead now, of more than 50 organizations just to draw attention to the problem of the functionally uninsured, people who have such high deductibles, co-insurance payments, and co-payments that they can't get the care that they need without having to turn to GoFundMe or bankruptcy court. More and more people are realizing what's inevitable for them with the kind of health insurance that they have now. They're more receptive to the idea of, okay, let's try something else.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.